Continues, and we have a couple of guests with us from Indiana Regional Medical Center who are joining us this morning. Why don't you introduce yourself to our listeners this morning? Good morning.
Good morning. I'm Laura Jungwa.
And I'm Michael Jungwa.
Okay, and you are both certified registered nurse practitioners at the IRMC Physicians Group. And Michael, you are in family practice, and Laura, you're in the OB/GYN department. And I guess, Laura, you just started working at IRMC about a month ago. Is that right?
Yes. That's right.
How's it been so far?
Wonderful. It's a nice community hospital. The staff and physicians are very friendly, and they provide great care.
Okay, could you move a little bit closer to the microphone? Let's find a little bit about you. You're not an Indiana native, are you?
No.
You're from out of the area?
Correct. Well, I grew up in Alberta, and I went to Penns Manor High School.
Well, that's Indiana County. Okay, so you
I
are.
graduated in 2006.
Okay, and what made you want to get into this field?
I always liked helping people growing up, and I just felt that this would be a career to continue to help, continue to help people. And nursing's very diverse. You can do a lot of different things with the career, and I'm glad I did it.
Was one of your goals to get a position at IRMC?
You never know where you're going to end up, but I'm glad I did because it's a nice community hospital.
Yeah, did you have any other possibilities of where you could have begun your career at?
I worked at Conemaugh as a nurse for the bulk of my nursing career, and then after nurse practitioner school, I did some family practice, and then I got back into women's health, which has always been a passion of mine.
Okay, and Michael, let's find out a little bit about you.
I grew up in Johnstown and then moved to Seward area, and also worked at Conemaugh, and we ended up going to nurse practitioner school together, so that's how we ended up meeting, and I guess the rest is history. But I work up there at family practice at the Overlook building there, and it's kind of on campus at the hospital. If you look up on the hill, you see it there.
Yeah. Now, is that an advantage, both being together and working at the same hospital?
I guess there's good and bad, but we don't see each other, so.
Yeah, we could carpool someday.
Yeah.
Exactly, save gas.
You can, maybe save on lunches, make each other lunch
Yeah.
before you leave in the morning. So you both started out as registered nurses, and I guess when you go into the medical field, you have to decide what direction you want to take, right? Maybe some, folks, they want to be the doctors, and the others want to be the nurses. What factors helped you make your decision?
I worked as a nurse for a while and kind of felt like I wanted to do a little more than what I was doing. Obviously I was helping people where I was at, but I felt like if I took that next step, I could maybe help people a little more even, and so far so good. So what are the differences between a registered nurse and a physician's assistant?
Nurses are trained to follow a patient-centered model, which focuses on disease prevention, health education, and basic assessment. But as certified registered nurse practitioners, we incorporate all of those things. Plus, we add on in-depth assessments. We can diagnose and we can treat.
Of course, when you start out in the medical field, a lot of schooling goes into that. How much was it for you?
I guess about 4 years for nursing school, and then probably about another 3 for practitioner school. So,
And we went through Carlow University.
So you went through together?
Yes.
And did all 7 years there?
Yeah.
3.5 at we met in nurse practitioner school.
Okay. All right. Yeah, I think a lot of times people don't realize that to come up with these positions, as you see, you spent 7 years,
Yes.
getting the education that you need. So it's not something that you just walk in and, 3 or 4 years later, you're ready to start your career. But you had to decide family medicine. And what were some of the factors that helped you pursue that?
Well, I guess as a family medicine practitioner, you can kind of do it all. You can kind of, I don't know if you're the jack of all trades. You kind of, diagnose and treat pretty much conditions throughout the lifespan, and you kind of have to be on your toes because you never know what's going to come in next. So it's kind of fun and exciting in that regard.
And you get to work with all ages, right?
Yes, yeah, from baby till elderly. Yep.
Okay, and then Laura, you chose the obstetrics and the gynecology department. What were some of the factors that helped you do that?
When I worked as a registered nurse, I was a labor and delivery nurse. I really enjoyed my job as a labor and delivery nurse. So once this position opened up, I jumped on it because it was something that I really enjoyed and was passionate for. So.
Did it take a while? Was it hard to sort of feel like one of the family over at IRMC? I know those folks over there do such a great job, and everybody always seems to work so well with each other. Did you find that was the case?
Yes. I felt very welcomed and enjoy going to work every day.
Mm-hmm. Michael, same with you?
Yeah, it's pretty easy to get along with everybody here, so it's nice.
Has there been any big surprises so far? Something that you didn't realize that would be part of the position or part of the job?
Not really. I don't know. Sometimes I feel like you don't expect to see some patients and some conditions that you end up seeing,
Mm-hmm.
but it always is fun and challenging at least. So.
How important is it, and do you get help from some of the folks in your departments that have been there? They're the veterans. You can go ask them questions or get some advice from them?
Yes, every day.
Every day.
Yes.
So that's almost like continuing your medical education.
Yeah, and that's one of the benefits to working here is everybody that you talk to, doctor-wise and provider-wise, PAs, NPs, otherwise, they seem to be pretty friendly and helpful, and they don't look down upon you if you have a stupid question.
Mm-hmm. Well, you know the old answer, there are no stupid questions, just stupid answers, right?
Yeah.
Now, Laura, does an OB/GYN nurse practitioner ever have to deliver babies? Is that part of what you do?
No, that's not part of our role.
No.
But we can take care of pregnant patients. And then close to when they deliver, usually our physicians see them closer to delivery.
Mm-hmm. Well, you never know. That might come up sometime, right? I'm sure that you've studied that in medical school and had some teachings about what to do if that ever happens. As we said, Indiana Regional Medical Center, nice community, and both of you being from the area, that had to be something that you said, we know what Indiana Regional Medical Center is all about. That would be a great place to work.
Yeah.
Yes.
Yeah.
Now, I understand that you recently had a baby of your own. So what is it like being first-time parents?
It's challenging, but in a good way.
What did you have, a boy or a girl?
A boy.
Okay, and how old?
He'll be a year on the 22nd.
Oh,
this
so
month.
he's probably standing up now,
Yes.
Yeah.
walking around.
Yep. He's,
Right.
He's getting a little more active and a little.
He has his
little-
own personality for sure.
Yeah, I'm losing a lot of weight chasing him around.
Yes. I mean, feeding is a big responsibility, and it takes up a lot of time. But that's good to hear, and I know that you're going to have a lot of fun. I have a couple of granddaughters. They're 2 weeks apart, and they're 8 months old. So, the crawling, the standing up, the holding on, and have you heard any words yet?
A few.
Dada. Yeah.
Right, that's a good one.
Yeah.
That's one of the first ones. So there's going to be lots of surprises coming along. Make sure that you take photographs
Oh, yeah.
or movies. Be-
Taken many.
yeah, because it goes by so fast. And it's always great to have those to look at and to reflect on. And it's good for when your children get older and they say, I never looked like that. You did. We have proof. It's right here. Now, besides working at IRMC, hobbies, interests? What are some of the things that you like to do?
Right now, it's summertime, so we like to do a lot of outdoor stuff. With having a baby and we're in the process of moving, I feel like we haven't had as much free time lately, but still fun to take him out once in a while and take him to the park and walk around with him. His eyes light up whenever he sees like
kids.
Yeah, other kids. Now, what were some of the things when you were growing up that you were into? Were you sports minded or?
Yeah,
Did you?
Me and my dad did a lot of baseball
Okay.
and sports and stuff like that, yes.
Okay, so maybe in a year or two you can take them down to PNC Park or over to Altoona to watch the curve.
I expect to, yeah, definitely.
Okay, Laura, what about you? What's some of your interests?
Right now, being a mom takes up most of my time, which is great. I enjoy being outdoors and just being with family and friends.
Some of your activities when you were growing up, what did you like to do?
I ran cross country. Yeah.
Very good. Did you still get a chance to go out and jog a little bit?
Not as much as I'd like, but some days we do.
Okay. And maybe you'll get your son involved
Yes, that would
as
be
he
nice.
grows up. That's a great family entertainment. All
Yeah.
three go out for a jog and watch the kid pass you and
Yeah.
can't catch up to him. That is super. Well, how can parents establish care with either one of you? Is there a phone number or a way that they can get in touch with you?
Yes, they can call 888-452-IRMC or go to www.irmcdocs.org, and we're both accepting new patients.
All right. Well, it sounds like it's the beginning of an exciting career. Do you plan on staying here at IRMC for a long time?
Yes, we hope so.
Yeah,
You
until
know.
they get rid of me, I guess.
Okay. Now, where are you folks living right now?
We live in Evansburg.
Okay. In the neighborhood.
Uh-huh.
I forgot to ask you, Mike. You went to school in Johnstown High School?
I went to Johnstown for elementary, ended up going to United for high school.
Okay,
We
well,
moved out here, so not too far either.
That is super, and we want to welcome you to Indiana and to the IRMC family. Nice to have you along. Now, what you're going to have to do is, in a couple of years, come back, see us here on Indiana in the Morning, and we'll compare notes.
Well,
Good.
he'll have a couple more kids by then. Probably,
That's one of the things that we'll be checking on too. Well, thank you so much for joining us, and good luck and have a great rest of the summer. I think the weather is finally starting to cooperate.
Thank you.
We are Indiana in the Morning here on WCCS AM 1160 and 101.1 FM. We're brought to you by First Commonwealth Bank. And coming up at the top of the hour, we'll get the latest news from our Fox network. And Josh will be along with our final look at Indiana County news and another rundown of some sports headlines with Jack Benedict. And don't forget, coming up next hour, we're going to be speaking with Sarah Rutledge, who is with the Welcome to Indiana group. They're the groups when you come into town. They have the welcome signs, and they usually plant some nice flowers or maybe a tree or two. They are in charge of that. And Sarah will be with us next hour here on Indiana in the Morning. And coming up tomorrow on Friday, 7:45, our weekly visit with Bob Pollock from the Indiana County Extension Office. Remember, if you have a question for Bob, you can call it in during tomorrow's program at 7:45. And then Friday at 8:45, we'll be hearing from Tom Stutzman, who's the Indiana County Emergency Management Agency Coordinator. He recently talked with our Josh Widdowson, and that will be part of tomorrow morning's Indiana in the Morning program. Also, coming up next hour, we're going to give away another one of our Summer Vault wristbands. So make sure that you're listening for that opportunity. And remember, if you already have a wristband, you can join us. Our next opening coming up on the 20th at the Indiana County YMCA. News.